Hello, ladies and gentlemen, dear dentists, dear teeth enthusiasts. Great that you're here, spending your precious time with us at the Speaker's Corner here at the IDS 2025. Thank you very much for that. And it's 11 and time for the next presentation and the next panel. That's really great that we have a lot of speakers here on stage. Everyday Practice Live presents modern dentists with new challenges. I think you know all about that. Increasing patient expectations and tight time slots included. But today, you can expect a lecture that addresses precisely this thing. The next speaker will present together with VOCO a groundbreaking new material that could revolutionize your daily work. You can look forward to practical tips, fascinating insights into his workflow and exciting scientific background. And for the panel discussion, we will have two other guys on stage. They're already waiting here on the front row. Dr. Christoph Hahn, R&D at VOCO, and Dr. Matthias Mehring, Knowledge Communication at VOCO. And please, first on the stage, he's already waiting here directly from the UK. Please welcome Dr. Soneji on stage with a big round of applause.
Good morning. Thank you, David, for such a lovely, and thank you all for such a warm welcome. So I'm here to present a revolutionary new concept and innovation from VOCO. And I want to start with a question. Can one magic material have unlimited possibilities? So I thought I'll add to my bio and introduce myself in a slightly unique way. Hi guys, I'm Ash Soneji. Welcome to Queen Square. I'm going to teach you about the magic of composites. It's got a couple of queens, but what's really interesting about them is that if you really focus in the center, they just seem to blend together like a composite should. Welcome to my surgery. This is where the real magic happens. My name is Ash Soneji. I'm a general dentist working predominantly at Queen Square Dental Clinic in Bristol. Okay, so you've seen my office, and I thought I'll introduce the topic with a little bit of the evolution of resin composites. So, we've come so far, and where did we start? Essentially, in the 90s, 50s, and 60s, we tended to see glass-filled PMA-based resins and BIS-GMA macro-filled. This was the advent of the material, and the first version of the material was often self-cured, so it was in need of much improvement. As we moved into the 70s, we started to understand that having more highly filled and macro-filled restorations of between 0 to 5 microns filler particles did give us many advantageous properties, and this is where we started to see an evolution of the material as acid, etching, and enamel technology also began to improve. These restorations often had quite rough surface texture. So the demands of the practitioner often became more driven by aesthetics, and we wanted a more aesthetic anterior restoration. And that was the evolution of the microfilled restoration. The benefit of this is we were able to control the filler particle size between 0.4 and 0.04 microns, and this gave many advantageous properties, particularly in the polish. So we had a much smoother surface texture. But the demands of patients and practitioners also began to grow. And this was the birth of a hybrid material. The concept of having a universal material has been something that we've recognized for some time. And actually, the way that we were able to do this is by having a mixture of filler particle sizes between less than 2 microns and between 0.04 microns. So we also started to see a more traditional chemistry that we see these days, which is a combination of the inorganic filler and the resin matrix, as well as the initiator molecule to set off the polymerization reaction. And here we can see much more established visible light curing. So this started to meet the demands of this practitioner much more, having more advantageous properties, better wear resistance, much more fracture resistance, better in load, Also some improvements in aesthetic, whether we're using it posterior or anteriorly. But again, the real breakthrough was nanotechnology. In the millennia, we started to be able to really control the fitter particle size and move more to between 5 and 75 nanometers. And this was a huge breakthrough and allowed us to get much closer to a universal restoration. The demands of the practitioner grew in 2010, and often they wanted something that was easier to place in terms of technique. The market had driven a bulk fill restoration, and hence the reason we started to see this, and C-factor became less of a concern as we had much less shrinkage and much less marginal leakage. As we move into the next decade, we're now researching a material that is providing us with incredible aesthetics, a truly universal material, and something that has smart polychromatic technology. So that brings me to a magic material. What are the ideal properties that we might want? So this is basically a next generation, truly universal restoration that is being re-engineered as an alternative to conventional hybrid composites. So what really would the requirements of this material be? We want great aesthetics. We want this restoration to blend in perfectly with the surroundings. We want it to polish beautifully. We want it to have good polish retention. Also the technique. We want this to be really versatile, whether we're using a fast modeling technique, bulk filling, whether we're incrementally layering. Much like our universal bonding systems, we want to take a lot of room forever out of the equation. And that's the reason why we're focusing a lot more on the technique, making things easier for you as the practitioner. And what about the function? Having something that's really highly filled will allow us to have much better compressive strength and allow us to perform with this material for the modern day patient and the modern day dentist. When we combine these, we also look at other properties. So a combination of the durability. I was talking about the polish retention. This is another durable factor, but also the compressive strength, improving the longevity of direct restorations. So the other factor was adhesion. As we start to look more at the biomimetics, we want something that is actually able to perform much more like the natural tooth structure. And as a result of that, by having better adhesion, again, reduced marginal leakage, reduced stain around the margins, and a much better adhesion and much more confidence in our adhesion. So that also comes down to technique. We just want a material that's easily sculptable and easy for you guys to use. The job's as stressful as it is, right? So this is where we've come to. We want to re-engineer a material to give us ideal properties and handling for all applications. This is our goal. So I thought I would just try something a bit different and just start with a little bit of a passion of mine. I am a magician, and I also enjoy a little bit of close-up card magic. So I just need a quick volunteer, if you don't mind, if anybody is willing to join me at the front. You can come up, yeah, of course, yeah, sure. So what I've got here is basically a pack of cards, and I don't mind if you give them a quick shuffle. So can you just tell everybody your name?
Yeah. My name is Willie.
Yeah, cool. Just give them a quick shuffle.
All right.
And then what we'll do is I'm just going to actually do this, right? If I give them a quick shuffle myself, and Willie, I just want you to tell me when to stop.
All right.
Okay, ready?
Yes. Stop.
There, happy?
Yeah.
So take it, show everybody. I don't want to see what the card is. So just embed it fully within the deck, so there's no possible way you can shuffle it. Just make sure it doesn't go in your pocket or anything like that, and we'll try something if we can. Cool. So I already know what kind of card you're going to pick. You're very predictable. I feel like I know what the card already is, and I've got it, right? So here's the magic moment, guys, right? This is your card, right? 5 clusters. 5 is what you'd pick, right? No? Just keep a close eye on the deck. I don't know if that's much closer. But what's really interesting about the card is it's now very unique. So I can put a physical bend into it, and that bent card goes in the middle. If you just very quickly blow on the deck for me, and the card just literally pops up to the top. So I know what you're thinking. I'm just very skilled with sleight of hand. Let's just mix it up a tiny bit, And this time, I will get you to pick another card, right? So will this time, just tell me roughly when to stop.
All right. Stop.
Here? OK. Happy?
Yep.
Take it. And this time, you can show the audience.
Yeah.
And I'm going to stand really far away, and I want you to sign it. So sign the deck really well. I don't want to see what it is. So just sign the deck really well. OK, great. Make sure it's signed well, and I'm just going to pop it right into the middle, OK? So where is the card?
In the middle.
It's in the middle. We'll just do a quick pass, and yeah, it just pops up to the top. His signed card, right? So do you mind just popping the pen down for me? Just on, you can just pop it here. And if you just pass your hand for me. So that card's going in your hand. Where's the card?
In my right hand.
In your right hand?
Yeah.
No, it's at the top. OK. So just, if you place that card down for me, we'll just finish this off by me just handing you the whole deck. So if you put your deck out for me, pop that hand over the top. So let's hope the card is at the top. Let me just very carefully check. Oh, guys, this is embarrassing. How about we cure the deck? Imagine I've cured the deck.
Right.
Would you be impressed if every single card was invisible except for your card? Would that impress you? Yeah. Would you guys be impressed with that? OK, cool. Just show everybody your hand, and just show them the top card.
Top card.
Yeah? Cool. And show them the deck. So the deck is truly invisible. Thank you, thank you, thank you very much. Willie was the one that was doing the magic. Thank you very much for that, and you can keep the card as well. You can, of course. So you can come and have a closer look at this at the end. But what's the whole point in the trick? I didn't just want to show off my magic skills. There is a point to the story. And what I'd like to say is, wouldn't there be an amazing if we had a magic material that was able to, when cured, become invisible and meet amazing aesthetic expectations? And today I'm proud to say that we have. With the innovation from VOCO, I introduce to you GrandioSO Unlimited. One magic material with unlimited possibilities. So it's a truly universal material with 4mm composite and 5 cluster increments. But actually, I was really humbled to be one of the first dentists in the world to get this material outside of the lab. So I want to talk you through some clinical cases. And what struck me about this material really was the ease of shade matching. Having 5 cluster shades really helps with that. The other big advantage is the fact that it handles so beautifully. This is something we've been looking for a long time. And also the versatility in its use, the incremental, whether I'm using it as a fast modeling technique, whether I'm using it as a bulk fill. It's versatile. So let's just talk you through a couple of clinical cases. So this is a case that's presented to me, routine, a general patient that would attend. And we can see that there's some secondary caries on the upper right 7, also detectable on bite wing radiographs. We can also see there's some caries present on the 6. So how did I achieve this in a realistic time frame? One of my early cases using this material, and this is the before and after. Here, I've used a different variation of techniques, and I've finished the case off. So this was the A3 cluster of the GrandioSO Universal, and one material, and we just finished it off with a little bit of final touch, just to give it that little touch of magic. So here's my workflow. Effectively, we start off with isolation. A little tip I can give you about the isolation is selecting a wingless clamp. If we have a wingless clamp present on the last standing molar, when we're using our sectional matrix system, the matrix will sit much better because the actual clamp, the wings won't interfere with the matrix. I often actually tend to use the B3 clamp for this. And what I also like to do is pre-wedge. So by placing wooden wedges, which I sometimes adapt as well, I use a handpiece to carve those. We're able to place them in between. We get a bit of separation of the tooth. Makes it much easier for the matrix to sit in bed. And the other big advantage is the fact that we protect the adjacent tooth structure. I routinely also use air abrasion. 27 microns alumina is brilliant because it provides better adhesion. It allows great disinfection of the material. So I'd strongly recommend air abrasion as your protocol. This instrument here is the cusp misura, and that's available from Style Italiano. And the benefit of this material, this actual instrument, is we're able to understand the thickness of the cusp. And effectively, if we're placing the instrument and the width of the cusp is sort of less than 2 millimeters, this kind of slot within the instrument slides right down. And that tells us maybe we don't have the best structural integrity, and we would consider going with an indirect composite or an indirect restoration long term. The instrument didn't go down, so I was confident we had good structural integrity. We're unlikely to get fracture of that cusp. I then moved to the sectional matrix system. So this is something I've adopted for some time now, and this is the dual force matrix. My rationale for that is it's a great, provides great separation. The other nice thing is you can see in that kind of embrasure space, the shape of the ring really sits nicely. And if we've got a little space, you can pack a little bit of Teflon tape in there just to create that lovely seal. And that effectively means that we get reduced flash, much less finishing our restoration. The other big benefit of the matrix system is the fact that it has anatomically shaped matrix bands, and they have got a little lip at the end. So if we're doing deep marginal elevation, we get a really predictable seal. So I'm very confident that we get a nice mesial marginal ridge. And that moves me on to my next point. This is another instrument by Stile Italiano, and this is the posterior misura. The big benefit of this is you can, if we've got a marginal ridge of the adjacent tooth, we can lean that instrument on the matrix and carve the shape of our marginal, the mesial marginal ridge. So effectively, we get the correct height of the composite, because that's a challenge. You know, it's so important that we get that part right, and if it's correct, our restoration will have excellent longevity. So what I often do is I convert class 2 cases to a class 1, and if the patient has good oral hygiene, I'm then dealing with a much easier situation. We've got a class 1, we've got better access, but I'll show you that in next. And then we just finish off. I use the combination of bulk filling and a few increments. Like, as I said, the material is versatile to whatever technique you prefer. So then, this is the case before. You can see we've got the final disinfection with the alumina. And what I tend to do is if the patient has particularly good oral hygiene, that's the time when I remove that kind of mesial metal matrix. So just a bit of a before and after. I was delighted with the end result. I was very happy to show off the photos to the patient as well, and he was delighted that we produced this great result in a good time frame. So I also wanted to test the limits of the material to some degree, in terms of aesthetics. A challenging situation is when we're replacing failing amalgam restorations. Often we get the leaching of the amalgam on the surrounding substrate, so the substrate can be quite dark. So how did the material perform there? So I removed this failing amalgam. It had a little bit of secondary caries. You can see my restoration. Again, this was, I think, with an A2 cluster of the GrandioSO Unlimited. Very easy shade matching protocol. And I'll just talk you a little bit of the workflow here. So you can see the nice sealing of the matrix. The other big benefit is that if it's got a very wide metal matrix. Sometimes if it's too narrow and we've got a very wide box, the matrix doesn't quite encircle the whole circumference of the tooth. So this is a big advantage of this system. And actually the material, when we've got a very rigid shape to the matrix, we can literally pack our material against that. And the nice thing about the GrandioSO Unlimited is we can actually it's really easy sculptable. And the big benefit is that it has a memory. Like you effectively pack it and sculpt it and it stays where you want. So I think you're gonna really like that feature. And it's something I know that VOCO have been working really hard on. So I'm just reiterating the point that what I do here, I'm using a combination of different types of burnishers, often very thin instruments. These are Hugh Freedy instruments. And I'm just very carefully carving the shape. I cure that increment, but it's really important that the patient has good oral hygiene and we've got a nice sealing and rubber dam inversion. Otherwise, we're going to get blood contamination and we end up with a very messy situation. So if we've got a good patient with oral hygiene, I often remove the matrix and we're in a much easier situation now. We've got much better access to the cavity and it makes your life much easier. So just to talk about how I finish the kind of final aspect, we've obviously produced that mesial margin. And we can bulk fill here. If you're using a fast modeling technique, you could put one whole bulk fill. I often find sometimes doing it in 2 increments, you can get that single line a little bit easier. But it doesn't matter. You do what works for you. And really, once we've got the nice carving of the fissures, I often get the question, how do you make the tints look good without the tooth looking like a big blob of color, really. And the secret to that really is the humble K-file. This is such a fine tool we can use. I don't do much endodontics, actually, so this is the rare time that I do use an endo file. And actually, I tend to get the final touch kit. The chroma of these colors are brilliant. They're really accurate to the kind of stains we'd see. And we just put a little bit very sparingly on the glove, and then we effectively place that on top. So yeah, and I sometimes use a compo brush and just gently tease out the color just to make sure that it's not too kind of viscous in terms of the nature. So let's move a little bit onto the science of the material. As we said, we've got a highly radiopaque, universal nanohybrid, and it's an evolution of existing technology that we have. The GrandioSO Unlimited has increased filler content, and actually, I'm staggered by the figures of this. 91% fill by weight gives me high confidence that this material is going to perform under compressive load. So whether we're using it posteriorly and anteriorly, I suppose, how do we get good polish and aesthetics with something that's so highly filled? This is what I'm really impressed by, actually. And it is the formulation of the inorganic filler and resin matrix, being methacrylate-based. So another interesting feature of this material is the fact that it's got 900% aluminium. This makes it highly radiopaque. So when you're looking at your postoperative radiographs, you can really clearly detect secondary caries, and you can really see a crisp, deep margin. This is a big advantageous feature. The cluster shades, as we discussed, 5 cluster shades, and the cluster shades cover all the Vita shades. Just to stress that those 5 clusters will cover all 16 Vita shades. And furthermore, we have some special shades. We often have patients that have much more of a demand for very white teeth. A particular part of the UK called Essex, there's many TV shows like this, ask for very bleached shades. So we have met those demands of these patients, and an opaque shade as well. So how has that happened? This is a graph comparing the spectrophotometer, and what it's showing us is the color intensity versus the value. And really, what I'm trying to get at with this is the single cluster, say A3.5, for instance, is covering many of the Vita shades, and it's providing this amazing chameleon effect. So how is it doing that? It's really optimizing light scattering. So it's the inherent components of the way that the filler and the resin matrix has been adapted to allow us to control light scatter and actually utilize the underlying substrate that we have. So I thought I would just sort of start to finish on an anterior case. How did this material perform when we've got a particularly aesthetically demanding patient? So this is a patient that presented to me probably about, I think it's been 2 months ago now, or maybe 3 months. And actually, what has happened here is her aesthetic goals were to remove the white patch. She also had these uneven edges on these mamelons that she didn't like about the teeth. She was very specific with her goals of making the diastema smaller, but not closing it completely. And I thought that was quite a challenging situation. She also wanted to be super minimally invasive, no preparation of the tooth. She's in her 20s, so real challenge. And with these cases, it's always important to present all of the treatment options, from the most minimally invasive to the most invasive. So we could do nothing. This is a treatment option for our patient. Vital bleaching can really help with these cases. It's important to remember that by whitening, initially what's going to happen is the white patch is going to go really striking white, but actually when the tooth rehydrates and we get more water, the oxygen-free radicals are removed, we get a whitened background, so the white patch may look less obvious. We talked about resin infiltration, microabrasion, megabrasion, veneers, whether direct or indirect, but the patient didn't really want to go indirect with porcelain. So the resin infiltration technique I wasn't confident with. The white patch was super, super deep. When I transilluminated, the white patch I could see was very deep. So we discounted resin infiltration as an option for this. I wanted to see if I could mask this with just additive composite. That's what we agreed on. This is the result we got. The patient was over the moon, pretty delighted with what we could achieve. But actually, a lot of it was about the smile design. So when we look at how I approach the smile design, this is the patient's kind of goals. I kind of said I thought it would look really nice maybe if we treated lateral to lateral, is that a possibility? We used some digital smile design as a way of communicating with the patient. She didn't like it. Of course, the teeth look higher value here. This was pre any whitening. So she said, I want less teeth treated. So I tried to go back to what her aesthetic goals were, and I said, how about we treat the centrals? I think this looked really nice. And the patient, again, being quite demanding, said, no, I want that small diastema. I want it to look like my mum's teeth. I want it a little bit smaller. So I said, how about this? And after a third revisit, she was happy with this. And this is a really important communication tool as part of our code diagnosis. So once the patient had accepted our goal, our end goal, I was quite happy to treat this case freehand, no wax up. And here I've isolated with a split dam technique. I've aerobraded again, 27 microns alumina. You can see how much more of those enamel prisms are exposed. Masking the white spot was challenging. I've used an opaquer here. And the secret is when we're placing the opaquer, not to place it in a really definite line over where the white patch ends. You almost blur the opaquer so that it's not a definite line. Because if we have some translucency in the material, that white patch will still show a little. So little tip with the opaquer. I then moved on to our mesial kind of aspects of the shells. I used the Garrison matrix for this, as I said, freehand. And then this is just confirming that I was happy with the approximation of the space of the teeth. I used the Williams probe to check. And once I was confident with that, I layered the A1 cluster shade of the GrandioSO Unlimited over the whole aspect of the tooth. So this is a direct veneer, which I placed. And again, just love the handling of the material for that. Minimal air bubbles when I was doing this. And I thought, again, it had quite nice translucency to it as well. So here I've cured through glycerin and removed the oxygen inhibition layer. That's another important step. And we've moved on to our polishing protocol. So a little bit onto the polishing protocol, just a few tips on what I do here. I tend to use a fine, long tapered finishing instrument. And here what I've done is effectively used an orthodontic marker. You can use a HB pencil, but I find the markers are really easily available. And then I've just sort of carved the mesial and distal lobes and the midbody and just polished with a Softlex after I've done my initial. We then move on to the secondary anatomy. And often these patients, if they're a younger patient, has a small lobe present, which I've tried to copy those mesial lobes using various polishers, pre-polishers. ASAP polishing points as well are great for this, again, through clinician's choice. So after our initial polish, this is the patient immediately post-op. I saw the patient for a final review, and I think we got pretty good aesthetics. She was delighted and over the moon that we kind of met her request for this. One thing I will just come on to, so I'll just talk you through a little bit of the smile design again. This was our patient pre-op. We did some vital bleaching, obviously, and then this was our aesthetic goal with our smile design. And just to show you that we got pretty close. We got pretty close with the shape and the proportions of what the patient was trying to achieve here. To my delight, the patient had also seen her nail artist, and they'd put a diamante on their lateral incisor, which she refused to take off for the final photo. But here we are. I think it adds a little bit of sparkle to a smile anyway. So anyway, just to recap of GrandioSO Unlimited, what are the features that I think are be advantageous to us as the clinicians? I've seen firsthand that the material is great in anterior and posterior. I think we are very close, if not there, with a truly universal material. Actually, the 5 cluster shades are very versatile, easy to use, and I think you'll find shade matching much easier. In terms of layering, like I said, the material is versatile. So up to 4 millimeters thickness, we're going to get really effective curing. I know VOCO has been working very hard on that. And in terms of the excellent handling and sculptability and polishability, you'll be over the moon with the polish. The other thing important, it has got excellent compressive strength. So despite having all these characteristics, you can be confident that you've got high strength with this material. So I thought just a few final thoughts. Remember to present all the evidence-based contemporary techniques when we're treating our patients. And really, our primary goals are to do no harm. We all sign a Hippocratic oath. We have professional ethics. So we always start with the most minimally invasive option first, because we don't want the patient entering to the restorative cycle too early. Ultimately, that work is going to require replacing at some point in time. And just use things that are going to make your life easier. As I say, the job is stressful as it is. So anything that's going to give you much more predictability and confidence, really think about using that. So yeah, I'd like to thank you for your time, but I'd just like to finish with a little bit of inspiration, keep it a bit magic related. I was actually reading with my daughter before we came to the conference, and I was looking for some inspiration or something to finish with, and ironically, I came across a quote about magic. I often like to relate magic to dentistry, because when we do magic, often people are amazed with what a trick we can achieve, and patients actually generally can be impressed with what can be achieved by modern dentistry. So yeah, I thought I'd leave you with just a little bit of inspiration. And as I said, I'd really like to thank you for all of your attention and your time. And we would love to open up a panel discussion. I'm going to invite my colleagues on stage and would love to address any questions that you may have. Thank you very much. Yes.
Thank you very much.
Thank you.
Take a seat over there. Thank you very much for introducing the product to the audience and actually the technology. It's an innovation, as we have learned. So now we are able to cover not 2 millimeters, but 4 millimeters. How did it change your clinical workflow so far? Maybe you can comment a little bit on this a little bit further in addition to that, what you already mentioned there.
I think one of the thing that struck me the most about this material was the handling and the memory, the sculptability of this material. So the fact that it has this sculptability and it stays where you like it to, I think this was a big advantageous factor. So in terms of a workflow point of view, it's probably given me the confidence to speed up the workflow a little bit. Often in that area where I was talking about on a class 2 restoration, that mesial ridge is a common place we can get voids. Whereas I was very confident that this material would fill in that void. Also, the fact that it's a true 4 millimeter cure, I was very confident in getting a really good cure in that situation.
Okay, yeah, thanks for highlighting this. In addition to the clinical aspects, we also want to talk a little bit about the science behind. So that's why we have also here on stage a researcher perfectly knowing about that material. But I would like to take the opportunity first to ask whether there are any questions from your end, from the audience, that you would like to address to Ash or to us in general. So if there are any questions, there is one over there. Maybe you can get a microphone. It's coming. Over there.
How does the shrinkage compare to previous versions of the product? The shrinkage percentage.
Sorry, could you repeat the
The
question?
percentage of shrinkage that you expect from that material, as compared to other products, to previous products and competitors.
The volumetric shrinkage is 1.44%.
So it's in comparison to the older technologies, so it's even lower. So that's also kind of an innovation. So we also develop in that direction. Of course, when you want to place it higher curing depth or deeper, so you also have to look at the shrinkage, which ends up potentially in the shrinkage stress, but Ash already mentioned. So we are quite familiar with that already, with the bulk fill materials, the functional ones. So, and this is what we adapted to that material also. Are there further questions from the audience? So maybe we then can just talk a little bit further. We have a couple of minutes left. So what about the curing depth in total? So we saw that's kind of a universal material. How does it really help the 4 millimeters? So
Yeah.
Can you comment on this a little bit more?
Yeah, absolutely. I think a few advantageous factors in the posterior and the anterior zone. So when we're working posteriorly, for instance, even if I'm kind of treating an MOD, for instance, I'm very versatile and very confident that I can maybe fill the whole space with a bulk fill technique, but also still get good aesthetics and carve the material effectively. So it's a big advantage there that we can be very work with much larger cavities and still be confident that we'll get a great filling of those voids, but still not worry about our occlusal anatomy so much. We'll still be able to do that. And I think other materials that I've used here often one of those factors will have to be limited. But maybe this is a bit more unlimited, I think.
Okay.
The other point that I think I'll raise is in the anterior, actually, sometimes we do have a patient that comes in that has the expectation of us restoring a class 4 on the day. And I find this a very stressful situation because often if the patient's got quite high aesthetic demands, we have short appointments to restore these fractures. And I'm very interested to see how this material will perform in those situations because having such a large increment that we can cure in a bulk fill scenario, it may also help with class 4s, big volumes of the composite. So I'm excited to see how it will work there. And I think it will be a really positive effect on those situations, yeah.
Okay, so am I correct in saying then it gives you kind of confidence?
Yeah.
Even more confident than you had before?
I think so. I think I'm starting to move away from thinking about more little increments. And I think that's a confidence thing. I think I felt that, some certain materials, I was still very much placing them in 2 millimeter increments.
Okay.
But, I can be confident that this material has the technology available that we'll get a really true full depth of 4 millimeter cure.
Okay. Yeah, thank you very much. So I'd like to come also to the shade system that was mentioned. Maybe it's more a question for R&D. So we have learned, so we need 5 shades, 5 cluster shades for that. So why is that? Can you comment a little bit on this? So what is the reason for 5? Why not 1? So I've seen products coming with 1 shade, covering everything. So maybe a few comments on that from your end.
Yes. Obviously, right now there are a lot of different solutions to this on how to combine the different colors that can be matched with 1 shade. You see 1 color, 1 shade, 3, 4, 5, 7. And our opinion is that 5 shades is the minimum that you need for aesthetic restorations. And there are also different approaches on how to combine it. So if you remember the shade, the slide, with the color intensity and the brightness. And for the dark shades, it's important to combine colors that exhibit a similar brightness.
Yeah.
And the further you go to the brighter shades, the color intensity becomes more and more important. It's based on our calculations, and this is why we have different groups with A2 and A1, for example. So we strongly believe that these 5 shades.
So we can conclude maybe that 5 shades is, let's say, the minimum that we need to cover everything sufficiently from the Vita color space.
Yeah.
Okay, yeah. So in your opinion, what do you think? What is the most compelling reason for any dentist to change? So now you said you have a material in your hand since 2-3 months, being one of the first dentists. So if you would comment a little bit more on this, maybe.
I think I'm still going to go back to the point on handling. I think you're going to love the handling of the material and also the polish that we're going to achieve with this. I have many other materials which I have used where I haven't been so confident that as a universal material, are we going to achieve a great polish? But I think this is one of the other compelling reasons that it's a truly aesthetic and truly well-handled, well-sculptable material, but you'll get great polish as well. Yeah.
And how can I get my hands on that product? So how can I?
Well, I think a good start would be make yourself known. We're in hall 10.2, so come and visit us. That's a good start. And also, in the future, I hope to be running some courses on many different materials and many different techniques. So this is a good way to maybe use the material firsthand, particularly if you're not as confident to go straight on a clinical case to use it. You can have a little bit of a practice with a hands-on session backed up by good theoretical evidence.
Okay, so yeah, there will be definitely training, hands-on courses. I'm sure you include some magic also there. I'm sure.
Well, the courses do have a little bit of a magical touch to them, and we're calling it the magic of composites, the magic of aesthetics. So yeah, watch this space.
You've now created some kind of expectation, I believe. So you have to think about new magic tricks. Maybe as a last thing, if there aren't any other questions, I would like to come back once again. You have shown the nice picture with So what is the ideal material? And you listed all the different aspects or features. And so from our end, I would just like to mention once again, so the steps that we made actually to really listen to the market. So what are the requirements? And Ash really summarized it quite well. So we want to have an easy-to-use material, of course, with the properties that everyone knows, that everyone expects. And so that's what we did over the years. Listen to all the users. And there must be anything further, so there is no stop in stopping with the development of the composites. And so this next step now, not only the shade matching, but also the increase of the curing depth, which is really a challenging thing. So this is what we achieved, and only because of the feedback that we received throughout the last years, or actually decades, I have to say. So you had the timeline there.
Many variables that
Yes.
R&D have to think about. So hats off to you for getting there.
Thank you.
Exactly. So are there any questions maybe left from the audience? The last chance. Okay, so then I would like to thank you both for being here and for presenting this amazing new material.
Yeah, big round of applause for these guys, and especially for you, Ash. That was amazing. Yeah, you motivated me now to get maybe another career as a magician. I don't know.
Of course,
It was really nice. Thank you very much, and of course for your expertise also, not only for entertaining.
Of course.
Thank you.
Thank you.
Thank you.